Welcome to today's deep dive. Our mission today is exploring the fascinating microscopic machinery of the human respiratory system.
Basically, the exact biological engineering that is keeping you alive right now as you listen to this.
Right, because the sheer volume of work this system handles it's just staggering.
Oh, absolutely. When you look at clinical data, general practitioners see anywhere from 700 to 1,000 patients every single year just for respiratory issues.
Wow, just for that.
Yeah, it really highlights the immense wear and tear our airways face daily.
Okay, let's unpack this. At its core, this entire system operates under extreme physiological pressure to do two things flawlessly.
Bring a continuous supply of oxygen in.
And aggressively flush carbon dioxide out before it can build up and poison your body's cells.
Right, and that process demands serious purification and protection right from the intake. Take the upper respiratory tract.
The nasal cavity, for instance.
Exactly. It has an incredibly rich, dense blood supply, which rapidly warms the incoming air, but that also makes the area highly vulnerable.
Which perfectly explains why a minor, direct blow to the nose almost guarantees a massive nosebleed.
Yeah, you feel it immediately, but that nasal cavity is doing heavy lifting. You've got cilia and goblet cells constantly secreting mucus.
To filter out large dust particles and waste in the air you breathe.
Spot on. And once filtered, that air hits the pharynx, which is a 12-centimeter pathway shared by both the respiratory and digestive systems.
But it's far from just a passive funnel, isn't it?
No, not at all. It actively changes shape to help us form vowel sounds for speech.
It's wild that our primary breathing tube doubles as a localized acoustic instrument.
It is. But sharing that tube for breathing and eating requires some extreme risk management.
Which brings us to the larynx.
What's fascinating here is how the larynx essentially acts as an automated security gate. The glottis and epiglottis function as literal trapdoors,
So every single time you swallow, they snap shut over the airway.
ensuring that whatever you're eating or drinking slides safely down the esophagus rather than dropping into your windpipe.
Here's where it gets really interesting. Once the air makes it past those trapdoors and into the thorax to the lower respiratory tract, it hits a dynamic defense mechanism known as the mucociliary escalator.
I love that term.
It's great.
Right.
You have to picture inside the bronchial tree, you've got these tiny, finger-like cilia beating in synchronized, organized upward waves.
They act like an army of microscopic janitors working overtime, constantly sweeping foreign bodies and dust right out of your lungs.
It's a brilliant piece of evolutionary engineering. And as those bronchi branch out into that familiar inverted tree structure, they lead into the lungs themselves.
Which actually have a rather surprising asymmetry.
Oh, right, to make room for the heart.
Exactly. The left lung only has 2 lobes, while the right lung operates with 3.
And wrapping those asymmetric lungs is the pleural cavity. The fluid inside that cavity is crucial because it completely eliminates friction during respiration.
Because if that pleura ever gets inflamed, that lubrication fails.
And suddenly, every single breath becomes agonizingly painful.
If we connect this to the bigger picture, understanding these mechanics is exactly how clinicians assess a patient when this highly tuned machinery misfires.
Just looking at the math of breathing tells a vivid story.
Yes. A baseline dropping under 12 breaths per minute indicates bradypnoea.
Which is a classic red flag for opiate use.
Conversely, spiking over 25 points to tachypnoea and severe respiratory distress.
But beyond the math, there's the physical assessment of those mechanics, like tapping the chest.
Percussion. That can reveal the dense, fluid-filled consolidation typical of pneumonia.
And through auscultation, clinicians are listening specifically for the abnormal airflow dynamics.
Which immediately indicate asthma or a deep-seated infection.
So what does this all mean? It means that every single effortless breath you take relies on a beautifully complex, hidden world.
An inverted tree of trapdoors, escalators, and fluid-filled sacs.
All working in perfect harmony just to keep your cells oxygenated.
This raises an important question. Since that mucociliary escalator is constantly beating upward to expel foreign dust particles, how much of our body's invisible energy is spent just running this microscopic conveyor belt?
That is a great point to leave off on.
And really, what happens to our cellular health when that delicate cleaning system gets completely overwhelmed?